Hello and welcome to Dunslet, a channel for intelligent and curious people like you who are searching for human sexuality in the age of artificial intelligence. And in this channel, we usually try to find the best possible answer to a question. And today's question is how to debunk sexual health myths. And this is part two, of course. In the part one, I talked about five methods, five scenarios, imaginary scenarios, but they are wrong notions which I debunked with scientific evidences. Now, this is part two, and let's dive into some common myths about sexual health and debunk them with scientific evidence. But before we proceed, let me tell you one thing. If you have not subscribed yet, please subscribe. It means a lot to me. And if you have already subscribed, tons of thanks for your support. I hope in the future, Wooden Slate will get your support like today. And finally, I also talk about human sexuality, human sexual behaviors in the age of artificial intelligence, sometimes sex robots, of course. But I always talk about scientific data and, moreover, technology above all. So please keep that in your mind. Now, next, let's dive deep into some common myths again. First of all, pulling out is an effective method of contraception in any kind of sexual activity. It's also called coitus ejaculation. Actually, the withdrawal method, that means, or pulling out, is not reliable at all. So it's a wrong notion that you can pull out at the time of your ejaculation and you can uh, you use it as a contraception method. But this is wrong because pre-ejaculate fluid can also contain sperms. Yes, I again repeat, pre-ejaculate fluid also can contain sperm, and that can be the root cause of pregnancy. So the failure rate with typical use is around 22%, not less, but it's 22%. It's a so using condoms or other birth control methods is more effective. Practically use two methods at the same time. And if you are uh, confused about it, please talk to your doctor. That is the best way possible. Next myth is oral sex is safe sex. No, sir, not at all. Oral sex can still transmit sexually transmitted infections like herpes, gonorrhea, and HPV. Using barriers like dental dams and condoms during oral sex reduces the risk of transmission, of course, but still, oral sex is dangerous. So, keep that in your mind. Next myth, you can't get an sexually transmitted information from a toilet seat. Okay, normally, sexually transmitted infections spread through sexual contact. Okay, so not by touching surfaces like toilet seats. Why? There are reasons for that. Viruses and bacteria causing sexually transmitted infections don't survive long outside the human body. Therefore, it's a wrong notion that you can get an STI from a toilet seat. So you don't have to worry about it at all. HPV only affects women. Look, HPV affects both men and women both. It can cause genital warts and cancers to both sexes, and vaccination can only prevent most HPV related health issues. Everyone should consider getting the HPV vaccine. And if you want to know more about it, please talk to your healthcare provider. Best talk to your doctor. They will give you more constructive suggestion about it. But of course, you need to take the expert's suggestion. Final myth of today is birth control pills protect against sexually transmitted infections. Sorry, birth control pills prevent pregnancy, maybe, but sometimes not, of course, but offer no protection against sexually transmitted infections. So, condoms remain the best defense against sexually transmitted infections during intercourse. So, use it and, of course, encourage others to use that. That is the best possible way to prevent or protect yourself against any kind of sexually transmitted infections. Now, what are the scientific evidence and sources I have got? Number one is Mayo Clinic. Mayoclinic.org is the website. You can go there and check all these things there. It's a very reliable source of information. Centers for Disease Control and Prevention, that means cdc.gov. It is also a very reliable source. I have give this in my description, so you can go and check this. Thanks for watching. Thanks for your time. Have a nice day. Take care, and of course, stay safe.